Hello, I'm Dr. Daniel Ramirez, Jr. I am a vascular and endovascular surgeon here in HCA, Florida, Heart and Vascular Care. The great thing about vascular surgery is that we take care of problems throughout the whole body, from everything outside of the heart. So from diseases, carotid diseases, arteries in the neck, arteries in the leg, abdominal aneurysms, thoracic aneurysms, everything outside of the heart and outside of the brain. The most common procedure we perform is generally patients that have vascular occlusions in their legs, and they suffer from debilitating pain in their legs from lack of blood flow. A lot of patients have wounds in their feet, wounds in their toes, or gangrene from smoking or from diabetic disease processes. And what we do is we go in and we open up the arteries, either endovascular or doing them open, saving them and preventing them from losing their extremities. We also have patients that have abdominal aneurysms that we can take care of with an open procedure or an endovascular procedure with an endograft or an endostent. Arteries in the neck as well, where patients have carotid disease, and prevent them from having a stroke, or patients that have a stroke and that have diseases in their arteries in their neck that cause them to have that stroke. We take care of it. So it's very gratifying for patients, because generally whenever we open up the blood flow, they can start walking right away. Their pain resolves right away. Just to talk about diseases going to your intestines, there's diseases where your arteries going to your intestines are blocked. And these patients have severe pain in their abdomen, especially after they eat, and they're not able to eat. They get a food fear because of the pain, because of lack of flow. And we're able to go in there with a catheter and open up that blood flow to the intestines, and actually they start eating again.